the value of a minute during an emergency. For a family rushing to a loved one to the hospital, it is everything. For someone gasping for breath, it is life itself. And yet, in a country as vast and advanced as India, access to emergency medical services remains unpredictable, unorganized, and in many cases, dangerously low. Isn't that unacceptable? Today, we live in a world where everything is at our fingertips. Groceries, clothes, ice cream, coffee, everything comes to you in less than 10 minutes. Why should it be different for emergencies? Why? Healthcare is not a privilege, it's a necessity. If we transform the way we access everyday conveniences, why must emergencies be any different? This is why we are here today. Because we know emergencies don't wait and medical help shouldn't either. I'm incredibly proud to introduce Zenzo, the largest ambulance network with 25,000 validated ambulances in 450 cities in India. What started as a small initiative in Mumbai is now nationwide life-saving force, ensuring that medical help arrives in less than 15 minutes. Think about it, 15 minutes. For too long, people have struggled to find a reliable ambulance service. They've made desperate calls and faced delays. Many have extorted in the most vulnerable moments. And that ends today. With Zenzo, that changes. One number, one app, a single platform that instantly connects you to the nearest ambulance, whether in a metro city or in a remote village in India. We are also fixing one other biggest problem in emergency care, which is unfair pricing. For the first time ever, Zenzo introduces one nation, one pricing for ambulance services. Basic ambulance will be 1,500 for up to 5 kilometers and a cardiac ambulance will be 2,500 rupees for 5 kilometers. No hidden cost, no last minute surprise, no surge pricing, just fair, transparent pricing because medical health should never be a luxury. We've also launched our own ambulances and partnered with trusted ambulance owners across India to make sure that no call for help goes unanswered. Zenzo is just not about speed, it's about fairness, access, dignity. It's about making sure that help reaches you, not based on where you live or what you earn or who you know, but simply because you need it. We are not stopping here. We have introduced 5G technology in emergency care. Our 5G ambulance sends real-time patient data to hospital before ambulance even arrives. The ambulance is right here outside parked for you to see it. This means doctors can start making critical decisions even before the patient arrives into the hospital. When seconds matter, this can save lives. We are also redefining who can be a first responder. A first responder is a person who can save a life, who's standing next to you, who's trained on first aid and CPR. Through our partners with Zomato and many other leading e-commerce and mobility players, we are training riders in first aid and CPR. These individuals who are always on the road can now become lifesavers in critical situations. Because in India, emergencies don't just happen in hospitals. They happen everywhere. Roads, offices, home, in places where medical help isn't immediately available. The more trained first responders we have, the more lives can be saved. In 2024, Mumbai recorded 5,000 road traffic accidents, resulting into 1,100 fatalities. Across India, 1.5 lakh people die in road accidents every year. And 30% of those deaths happen because of lack of medical help. That must change. Zenzo is redefining care, and this is just the beginning. We are upgrading ambulance. We are working hard to improve response time. We are bringing together government, hospital, business, communities to build a unified emergency care system that this country has never seen before. Because in the end, it's not just about numbers. It's about real people, real families, and real moments of need. Before I end, I would like to touch upon my experience, the experience of this company and this group. You must be thinking, I'm here talking such big things, and who am I and who is this company making such big claims? So my dear friends, we have been in emergency response space for the last 20 years. We have been working with different state governments, with different companies to provide emergency medical service. The founders who are here and the team which is here, we are determined to provide emergency response in India in less than 15 minutes. We have 20 years of experience working with government to provide ambulance service, medical mobile units, mobile clinics, health helplines. We also run veterinary animal ambulances. So we have a vast experience, and we are very confident that we will be able to achieve this dream of providing ambulance service in India in less than 15 minutes.